New data just out today from the CDC shows just how bad this year's flu season really is. And the bad news is that it is not slowing down right now. The CDC says there have been at least 7.5 million cases so far just this season. That includes some 81,000 hospitalizations and tragically more than 3,000 deaths. Unfortunately, all of those numbers are trending upwards. Joining us, founding director of Boston University's Center on Emerging Infectious Diseases, Dr. Nahid Bhadillia. Doctor, thank you so much for joining. So take us inside this new data that we just got from the CDC today.
Yeah, Antonia, I think what's worrisome is that we seem to always have this bump after the holiday season, and seeing the speed with which cases are increasing kind of makes us worrisome for a year with a heavier flu season. And 2024 was actually the worst flu season we've had in a decade. So seeing this grow this way is worrisome for the healthcare burden that we may see. I will say what's driving this is a new variant called H3N2 subclade K, which has already been causing earlier flu seasons, more severe flu seasons in Asia and UK. So we're seeing that now here.
So does the available flu vaccine that everyone was encouraged just a few months ago to get, does it protect us at all against this strain? And is it worth getting right now if you haven't already gotten the shot?
Yes, yes, and yes. It protects, even though it's not the best match in terms of the yearly matches that we see, because the variant actually came out after the composition of this year's annual influenza vaccines were put together. But UK's data shows that particularly in kids, it's protective against hospitalization to up to 80%, and adults is about 30 to 40%. So you may still get sick, unfortunately, but you want to have those in your arsenal to prevent against severe disease and hospitalization. And particularly now as cases are increasing, getting it now before you head back to work is going to provide protection in the new year.
And how are our health systems doing in handling this massive surge? And I mean that from the local level, rural, urban communities, but also all the way up to the federal level at a time when we see people being increasingly hesitant to get vaccines. There's mis and disinformation out there, sometimes spread from the very top. Do you think that's complicating matters?
Well, let me start from the bottom up. I think what we know annually, even when it's not a bad season, influenza and respiratory viruses cost the U.S., whether it's direct medical or all-inclusive costs, somewhere between $50 to $100 billion annually. So if you have a rough year last year and you might have another rough year this year, it goes beyond just the burden on the healthcare systems. You may see this roll over into people's everyday, right? And I know not everybody may have this capacity to do this, but as you're thinking about going back to work in the new year, if you're sick, stay at home if you can. That's going to help decrease the transmission. In terms of the work around the federal government, the CDC recommends this influenza vaccine to everybody, with the rare exceptions of some medical conditions. Everybody over 6 months should get this vaccination. And that's even the current CDC under Secretary Kennedy actually recommends that. So I would suggest people actually block out a lot of the dis and misinformation is out there and hear what the public health experts are saying around the protection of a vaccine that we have so much experience around.
So you mentioned people heading back to work, but what other advice do you have for people who, are riding public transportation, have to travel in the next couple days, or have kids who are going to go back in school in tight quarters with other kids? What can they do right now?
Again, one of the major things that you can do is get vaccinated. If you're sick, stay at home. And it's a very personal choice. But when I travel, I will once again say it is a personal choice. You should wear a mask if you're concerned about potentially getting exposed to others who may also be traveling who are sick.
Dr. Nahid Bhadillia, great to have you. Thank you so much for sharing your expertise.